You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Folks, the White House is currently holding their coronavirus press conference. Donald Trump is speaking. You know we're not going to carry it because he's frankly lying all the time, so it's not going to happen. As of today, there are 566,654 cases of COVID-19 in the United States in 3 U.S. territories. At least 22,877 patients with the virus have died. That's 4,843 more than at this time on Friday. 33,743 people have recovered. In his daily briefing, New York Governor Andrew Cuomo talked about the reopening.
Where do we go from here? Question of reopening, which everyone wants to do and everybody wants to do yesterday. I am at the top of that list. We have to understand on the reopening, as much as we have this emotion, we want it to happen and we want it to happen now, and we can't take this anymore, and everyone feels the same. It is a delicate balance. Remember what we have to do on reopening. And remember, it has never been done before. None of this has been done before. So anyone who says to you, oh, I know what we should do. I know. Yeah, you don't know because nobody knows. And that's the one thing that we have learned over and over again. And this place has never done this before. Also, you look around the world, you see warning signs from countries who have opened. And my point is to our team, I want to learn from those other countries, frankly. And I want to make sure we know from our studying and assessment of what's going on in other countries that what worked, what didn't work, and let's learn from those lessons. You can now go back and look at Wuhan province and look at Italy and look at South Korea and see what they did and see what worked and what didn't work. So let's learn.
Folks, civil rights groups sent a letter to members of Congress asking that they address 2 major provisions of the proposed COVID-19 relief bill that would exclude millions of immigrant families, including U.S. citizen children. Immigrants are frontline workers leading the response to the pandemic in places like public health, agriculture, food prep and delivery, and cleaning and maintenance. Joining me right now is New York Congresswoman Yvette Clarke. She is the chair of the Immigration Task Force, and whose Brooklyn district is largely made up of immigrants. Before I talk about that, Congresswoman Clarke, right now, happening at the White House, it's one of the most shameful, despicable things that we have seen. Donald Trump is literally bitching and moaning about media coverage. Now they're playing a video as we speak where he is complaining about the media's coverage. There's not been, so far yet, a single update on the coronavirus. It's all about his ego. It's all about this back and forth with Dr. Fauci, whether or not he will fire him, even though he retweeted something this weekend. I mean, I have never seen a more shameless, despicable human being occupy the Oval Office than Donald Trump. And what's happening right now is beyond shameful.
Roland, you know, we have to do all of the work for our communities despite what Donald Trump is saying and what he is not doing. It is critical right now that we focus our attention on saving lives in our community. We cannot be distracted by the Donald Trump show. He is inept. He is out of step. He is out of his league and he's in over his head. We have to look to the leadership of others within the administration, outside of the administration, and in the communities in which we live, because right now, again, he is purely a distraction in this time of an emergency crisis.
Well, there's a reason why we do not show, when he is talking, we do not waste our time showing anything from his news conference because it serves no value whatsoever. If Dr. Birx or Dr. Fauci are not at that podium, then we don't play it. And so that's why we do that on Roland Martin Unfiltered. That will always be the case. If anyone disagrees with that, that's tough. It's my show. But that's the call we'll make because this man lies way too much for us to keep giving out the information to our audience. One of the things that has happened. Go right.
It's dangerous, Roland. If he continues to be misleading to the American people, lives are on the line as we speak. Every hour that goes by in New York City, I'm hearing more and more sirens racing through the streets of my community, out there on the front lines trying to save lives. We don't have time to deal with this man's narcissism. We have to focus our energies on saving human life in the very neighborhoods and communities in which we live.
One of the things that is happening is the impact on immigrants. We had a guest on Friday, Johanna LeBlanc, talked about what is happening where they're sending people back to African nations. They sent back 68 Haitians as well. Members of Congress have said, stop doing this because you could potentially be spreading the virus there. They're not actually checking these folks before they leave. And so how they are treating immigrants during this crisis just goes to show you this anti-immigrant administration.
Well, this has been part and parcel of what we have witnessed from the day that Donald Trump was sworn in, and even before then when he came down the golden escalator. But now it has far more implications beyond just, the rhetoric, the ICE raids and everything else. It really means literally life and death. And as long as we have this virus in the Western Hemisphere, whether it's the United States, it's the Caribbean, it's Latin America, we will never be rid of the scourge of COVID-19. So it's foolhardy for him to do through his administration what he is doing. The sad part of it is that real lives are on the line. And at any point in time, we send individuals who are infected with COVID-19 into these very fragile developing nations that don't have a fraction of the healthcare infrastructure that we have here in the United States. We are in for a disaster in the making. And so I would really appeal to the State Department and those people of goodwill to really address this issue of deportations at this stage while we are still combating this virus, while we are still looking for a vaccine that could perhaps make sure that we can save lives. There's so much work that we need to do in terms of focusing on the United States population, those within our families and our communities, and making them well enough so that traveling doesn't become a dynamic where we are actually exporting and importing people, infected persons in and out of the United States of America.
One of the things that we talked about is that the reality is there are a number of people who are immigrants who are working on the front lines, who are essential workers, who are working at grocery stores, who are working at convenience stores. All of these people who are working in the medical field, all of these people who have ignored folks like this, have trashed them. It's amazing how millions of Americans are coming to depend on them.
Well, again, our economy is fully integrated. And we've just been in denial about who provides essential services in the United States of America, what the makeup and demographic of that workforce looks like, sounds like, and how they're able to be effective in our society. And we've not given them the credit nor the status that they deserve in our civil society. And now we are all paying a price for it. Because again, as you stated in the opening of your show, Roland, these are individuals that live in blended communities and blended families. Someone in the family is a citizen, could be a child, could be a sibling. Someone in the family is a resident of the United States. They have a green card, in other words. Someone may be a DACA recipient, a recipient of temporary protected status, or just be in between status, period. Someone is filed for them. They're here in the United States, awaiting for that filing adjustment. There's so many ways in which we have not addressed residents of our communities who are immigrants, who are in between status, and who are the most vulnerable. We have vulnerabilities, but when it gets to the point where you have a program being rolled out that has no provision whatsoever for the health and well-being of individuals we know live and work within our communities, we are opening ourselves up for the constant spread and circulation of this virus, because these individuals will be hardest hit, will be hesitant to go and seek treatment, will be food insecure, because indeed, if they don't work, they don't get paid. And those that are working as essential employees are not getting health care benefits, are not receiving PPE, the personally protective equipment to be able to interface with the public. And we have, again, a circular disaster that is taking place with respect to the health and well-being of these individuals in particular, but our entire communities in its totality.
Last question for you. New York Times had a big piece over the weekend detailing the faults and failures of this administration. What was stunning to read is how they are essentially, actually NBC News had another piece talking about how they're basically aiding and abetting corporations, where the United States is paying for chartered flights for DuPont to get their material overseas a lot quicker and then bringing it back on chartered flights paid by taxpayers. PPE would normally be costing $5, and then they're selling it to the United States for $15. And then so how in the world can taxpayers be footing the bill to make PPE faster and be paying 3 times more?
It's a criminality at a whole nother level, Roland. Unfortunately, the Congress is not in session to be able to do the type of official oversight that we need to do to make sure that we hold the Trump administration accountable for taxpayer dollars. We were actually just talking about that on one of our caucus calls just a few minutes ago. The issue is profiteering. We're seeing it across this nation, how the Trump administration is using the private sector to essentially drive up the cost of products that we need in order to arrest this virus, whether it's PPE, whether it's testing materials, so that they can profit from this before it even hits the ground and hits our communities, draining the coffers of states and localities that cannot afford to purchase these products because they're being price gouged. It's really a sin. And we know that this is typical of what we can expect from a Trump administration. The challenge is now holding them accountable for what they're doing, because, again, they are scamming the American people in many ways, profiting off of price gouging and setting up a system through which private interests are benefiting tenfold over taxpayer dollars for essential materials that we need to save life, to preserve life, and to get through this crisis. It's really a shame and it's a disgrace. We can't say that enough, but we're going to have to hold this administration accountable. Right now, we are in the midst of this pandemic. We are still in the emergency crisis phase. We're trying to move to relief phase, and that phase is being corrupted, unfortunately, by the Trump administration.
Congresswoman Yvette Clarke of New York, we surely appreciate it. Thanks a lot.
Thank you for having me.
I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.